Ladies and gentlemen, greetings. We are Team Affirmative, and we welcome you to this debate. Our topic states that how can African countries address the potential economic disparities created by access to genetic and genomic technologies through public funding initiatives or by incentivizing private sector involvement? And guess what? We chose public funding initiatives. Genetic and genomic technologies can potentially shape the future of the healthcare and economic equity in Africa. However, they have raised disparities in accessing them. As we stand on the brink of genomic revolution, African countries must address these disparities. Genetic and genomic technologies hold immense promise for addressing some of Africans' most pressing health challenges. However, access to these technologies remains uneven, often favoring wealthier nations and communities. And our stance is clear that we argue that public funding initiatives can bridge this gap by providing the necessary resources for research, infrastructure, and training, and hence ensure equal accessibilities and bridge the disparities that are existing. With public funding, ensures that genetic technologies are accessible to underserved populations, reducing healthcare inequalities, and then it ensures equity and accessibilities. Governments can even subsidize diagnostic and treatment costs for low-income communities. For example, in South Africa, the government has implemented programs that provide free genetic testing for certain hereditary conditions. This ensures that even the most vulnerable populations can access essential health services. Public fundings ensures public health prioritization. They allow the focus to remain on addressing widespread health issues such as sickle cell anemia, cancer, and genetic diseases, rather than profit-driven priorities. With public funding initiatives, there is no commercialization, which may limit access to only those who can afford it. Taking an example from the HHH, the H3 Africa Initiative, which directs funding toward genomic research focused on diseases prevalent in African populations. This initiative ensures that critical health issues receive attention without being overshadowed by commercial interests. And that is the goodness of having public funding initiatives. It also builds infrastructure. Government investment can establish public research institutions, the labs, and training programs. This creates a sustainable foundation for genomic medicine. It also ensures long-term benefits without dependence on external entities. For example, the establishment of genomic centers for excellence across Africa, which aims to enhance local capacity for genomic research and disease surveillance. This initiative not only addresses health disparities, but also empowers local researchers to contribute to global genomic databases. And African populations are adequately represented in scientific research. Not only that, public funding initiatives also increase accessibility. The public investment in genomics strengthens national health systems, enabling African countries to access new technologies and compete globally in genomic research. For instance, the Africa Pathogen Genomics Initiative, Africa PGI, launched by the Africa CDC, Centers for Disease This initiative has significantly increased the sequencing capacity across African nations. Before these programs, only 7 out of 55 African Union member states had next-generation sequencing capabilities. By 2022, this number rose to 31 member states, demonstrating how public investment can rapidly enhance technological capacity and improve health outcomes during crises like the COVID-19 pandemic and other crises. Talking about the H3 Africa initiative, this initiative is the very good example of public funding initiatives when it comes to bridging the gaps of the disparities that are arising. This initiative has successfully funded numerous projects aiming at building genomics research capacity in Africa. And by doing that, by providing grants for local researchers and establishing partnerships with international institutions, the H3 Africa has facilitated groundbreaking studies on diseases prevalent in African populations, such as sickle cell disease and HIV. These projects not only advance scientific knowledge, but also create jobs and stimulate local economies. Yes, the opponent side may argue that incentivizing private sector involvement is a more effective strategy for addressing disparities in access to genetic technologies. But I want to remind them, while private investment can drive innovation, bear in mind, it will always prioritize profit over the equitable access. It will always prioritize commercialization over the sustainability of the community. In many cases, private companies may focus on profit-making markets or urban centers, leaving rural population underserved. Public funding initiatives will ensure that resources are allocated based on need rather than profitability, based on priorities when it comes to health problems rather than commercialization, promoting inclusivity and addressing health disparities across diverse communities. To emphasize our position, the private sector adds value but cannot replace public funding's essential role. Public investment ensures equity, prioritizes health needs, builds sustainable infrastructure, safeguards ethics, and enhances global competitiveness. With government-led initiatives, the collaboration among researchers, local communities, and healthcare providers create a comprehensive approach to tackling pressing issues such as food security, disease management is quite possible. A balanced approach, collaboration, is crucial for advancing genomic medicine effectively. Thank you.